Hey there, future docs. Let's dive into the fascinating world of spinal nerve roots and how they handle the everyday stresses we put on our bodies. Imagine the spinal nerve roots as delicate bridges connecting the spinal cord to the rest of the body. These bridges are made up of dorsal, sensory, and ventral motor roots, all wrapped up in protective membranes. Their main job? Transmitting signals back and forth, giving us the ability to move and feel. Now let's talk about the mechanical forces that these nerve roots face. First up, tension. This happens when the spine stretches or elongates, like when you bend forward or backward. Nerve roots can stretch up to 18% of their original length without damage, but too much stretching can reduce blood flow and cause dysfunction. Prolonged tension might even lead to micro-injuries or fibrosis, which is scar formation. Next, we have compression. This occurs when pressure is applied to the nerve roots, like from a herniated disc or spinal stenosis. Compression can reduce the space around the nerve roots, leading to swelling, inflammation, and pain. It can also impair signal transmission, affecting both motor and sensory functions. Then there are shear forces, which are side-to-side movements between adjacent structures. These forces can also impact the nerve roots, especially during complex spinal movements. But our bodies are pretty amazing at adapting. Spinal nerve roots are elastic and have viscoelastic properties, meaning they can absorb and adapt to normal spinal movements. However, if subjected to repetitive stress, they can lose resilience. Thankfully, the surrounding cerebrospinal fluid cushions the nerve roots, reducing mechanical impact. Several factors influence the biomechanical behavior of nerve roots. Age is a big one, as aging reduces elasticity and increases susceptibility to injury. Health conditions like herniated discs or arthritis also increase compression risks. And of course, posture and movement play a critical role. Poor posture or abrupt movements can strain the nerve roots. Clinically, understanding these forces is crucial. Radiculopathy, or the compression or irritation of nerve roots, can lead to pain, tingling, or weakness in the limbs. Surgeons must consider these mechanical forces during spinal surgeries to avoid damaging the nerve roots, and rehabilitation often focuses on reducing mechanical stress and improving spinal alignment. So what can you do to protect these vital structures? Maintain good posture, strengthen your core muscles, and avoid repetitive movements or heavy lifting that could strain your spine. All right, let's quickly touch on nerve roots inside the thecal sac. These roots lack the protective layers of peripheral nerves, making them more vulnerable but also more flexible. They can stretch to some extent without immediate damage and resist pulling forces up to a certain limit before failing. The ultimate load capacity varies between ventral and dorsal nerve roots, with dorsal roots generally being more robust. The length of these roots also varies by spinal level, with lower levels like S1 being significantly longer and more susceptible to stretching and compression injuries. Remember, the biomechanical properties of spinal nerve roots differ significantly between their intrathecal and foraminal portions. The intrathecal portion is more vulnerable due to lack of support, while the foraminal portion is stronger due to surrounding connective tissues and bony structures. In summary, understanding the biomechanics of spinal nerve roots helps us appreciate how our bodies adapt to various stresses and informs better clinical practices. So keep these insights in mind as you continue your journey in the medical field. Thanks for watching, and stay curious, future doctors.